regulators could greenlight a COVID booster as early as tomorrow, making the shots available as soon as next week. Joining us to talk about this approval, what it will mean, and other health topics today is Dr. Bill Hartman, clinical trialist at UW Health. We always love having you on with us on Thursdays. If this latest COVID booster gets the go-ahead from federal regulators, like we expect it to, what do people need to know before they roll up their sleeve to get it?
Well, I think one thing to remember is that this particular monovalent booster was made versus the XBB.1.5 Omicron subvariant, which has not been really in our circulation here for a couple of months. That being said, studies this week have shown that it really induces a very good response against any of these variants that currently are amongst us, as well as the ones that we're keeping an eye on, like Iris and Parola, which are prevalent in the UK right now.
So it kind of gives a good blanket effect. What in terms of timing for people getting this, is now the time to get it?
I think so. We're seeing rising cases nationally. We're seeing rising hospitalizations and even a slight trickle up in the number of deaths compared to the previous 2 weeks from COVID-19. And so waning immunity, it's been about a year since people have had a booster shot. This is the time to get that in your arm.
There is a new study that just came out showing that a 2-week dose of a diabetes medication is showing promising signs of helping those who contract COVID and keeping them from getting long COVID. A diabetes medication, can you explain this?
Right. This is one of these weird things that happens with certain medicines. And metformin has various other uses other than just diabetes, but it's primarily used in diabetes. And in this particular case, they found that if you can give a 2-week dose of metformin started 3 days after you get symptoms from COVID-19, it will reduce the chance of you developing long COVID by about 40%. And so with the number of people that suffer from long COVID, and this could be somewhere around 65 million people worldwide right now, reducing it by 40% is a major breakthrough.
But for those who are currently suffering from long COVID, potentially, this is not going to do anything. You have to really get on this in the beginning.
You have to get on it in the beginning, yes.
Good to know. All right, let's wrap up here with the flu. Flu shots are starting to become more and more available. Now, there is some re-clarification happening by the CDC when it comes to what the flu shot actually does for you. And they're trying to get the word out with this new wild to mild ad campaign. What's the goal here? So
it seems that for years we've been asking the government to help focus the message here, that the flu shot isn't about keeping you from getting the flu, because there's plenty of people that get the flu despite getting the flu shot. It's really to keep the disease as mild as possible. So if you don't have the flu shot, it could be like a shark invading your body. If you do have the flu shot, it might just be a kitten purring on your ankle. So this is really a campaign to try to focus it away from the idea that you're not going to get the flu at all, and more as to if you get this and you get the flu, it's going to be a mild disease.
It's catchy and educational. I like it. All right, Dr. Hartman, we always appreciate it. Thanks so much.
Thank you.